Hello, everyone. Welcome to another wonderful webinar. My name is Jonathan, and I'm pleased to welcome you to today's webinar on the history, effectiveness, and misconceptions of group therapy. For those of you who are long-standing attendees of our webinars, welcome back. And for those of you who are new to EH in Canada, we are a leading nationwide network of treatment centers for addiction, trauma, and mental health. We offer inpatient services with centers coast to coast, as well as intensive outpatient and virtual options. For more information on this, visit our website at ehncanada.com. Everyone is on mute and cameras are turned off for today's webinar, but we'd like for you to use the Q&A box to submit your questions for our speaker throughout the session. There's a Q&A period at the end, and sometimes the Q&A doesn't work, so feel free to use the chat. I'm personally going to make sure that we keep track of your questions. We will be sending a follow-up email in the next week that will contain a link to the recording of today's session and your CEU or continuing education certificate. To stay updated on our future webinars and newsletters, we invite you to opt into our mailing list by filling out the form that will be linked in the Q&A chat. I'm located in Toronto, which is on the traditional territory of several nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. It is covered by Treaty 13 with the Mississaugas of the Credit. If you are new to this work and want to find out whose land you are on or grew up on, please visit www.native-land.ca. And now, let me introduce to you today's speaker. Liam is a clinical supervisor in the core program at EHN Edgewood Nanaimo, where he brings a strong commitment to the strength-based therapy and the therapeutic value of group work. He believes in fostering a collaborative, empathetic environment that empowers individuals to take ownership of their recovery. Liam provides clinical leadership that aligns with the principles of person-centered care. He emphasizes the importance of recreational activities as a therapeutic tool and finds that such activities enhance the group therapy process. Outside of his professional role, Liam enjoys snowboarding, surfing, hiking, and golfing across Vancouver Island, which further supports his belief in the balance of physical and mental well-being and recovery. Now, without further ado, I'll hand over the stage to Liam.
Awesome. Thanks so much, Jonathan. It's an honor and a privilege to be here today. I'm really excited to share with everyone a little bit of my experience that I've gleaned over the last several years working in this field. And as was mentioned, I am a clinical supervisor in the core program at EHN Edgewood Nanaimo, which is located on Vancouver Island in beautiful British Columbia. It's a bit gray out there today, but we've been blessed with some pretty nice weather as of late. Today we're going to explore the history, effectiveness, common misconceptions of group therapy. So I just want to first start off by saying that group therapy, in my eyes, plays a critical role in mental health treatment, and understanding its principles and applications can help professionals and clients alike. My name, again, Liam Broderick, and I just want to begin this session with a land acknowledgement. We respectfully acknowledge that we're on the unceded traditional territory of the Snuneymuxw, Snuneymuxw, and Sumanas peoples. These indigenous communities have been the traditional knowledge keepers of this land for generations. It's essential to recognize the history and cultural significance of this land and express gratitude for being able to live, work, and engage in healing practices here. This acknowledgement reminds me of the importance of inclusivity, respect, and cultural humility in therapy and mental health work. And this process of truth and reconciliation is not one that is taken lightly here. We work with many And we have an Indigenous healing program here at EHN Edgewood and Nanaimo that was started a couple of years ago now. On the grounds, we have been able to facilitate having a sweat lodge ceremony. And this has been something really special for the clients here, especially with a large Indigenous population. We have an Indigenous support worker here and a few other support staff members as well. And I'm just very grateful to be able to live here and participate in this abundance of nature that we truly have here. As Jonathan mentioned, I love being outdoors, and this is really special to me. So I've got a bit of a roadmap of where we're going today. We're going to talk about several things. I'll go off on a tangent a little bit, so please bear with me. I get excited about this topic. I'm going to go through an introduction to group therapy, just kind of covering the basics, historical development of group therapy, talk about where this came from, how it started, and that sort of thing. Theoretical foundations, the underpinnings, some important figureheads that are a part of this process, and some that we still use today as reference. Effectiveness across different mental health conditions, misconceptions about group therapy, applications of group therapy, advantages, challenges, and limitations. Introduction to group therapy here at EHN Edgewood and IMO, and some of the things that we're looking for. And then we also want to talk about what's this understanding? How does it show up? What are some of the things that we're helping clients to learn about themselves, to work with others, and that sort of thing? How it helps, strategies to maximize benefits, unique benefits of what we do here, what is meant by emotional honesty in group therapy, and how this can be conducive to the healing process, overcoming some common challenges, group therapy principles here, and then I leave you with a few key takeaways before we go into questions and answers. So here's the introduction. So by definition, formally, group therapy is a structured psychological treatment where individuals come together under the guidance of a therapist to achieve therapeutic goals. It's often structured, but sometimes it's unstructured, and we'll get a bit more into that as we get into the nitty-gritty. Key benefits, some of the things to think of. Shared experiences tend to help reduce isolation and normalize struggles. If I'm able to be a part of a group and I'm sharing my stuff, it's very likely I'm going to be able to work through some pretty strong emotions. Peer support fosters empathy, learning, and encouragement. There's this, verbal persuasion that takes place, and giving feedback to each other is very helpful, especially when we're talking about substance use disorder recovery. We're preparing people to make their way back out into the community. The last piece here is that it's more cost effective and efficient compared to individual therapy. And it's about 2/3 of the cost in most places. Obviously, here in inpatient setting, it's a part of the process. We have a big emphasis placed on the power of group therapy, and there's many reasons for it. So some focus areas to keep in mind. Um, Enhancing interpersonal skills. This is something that we're constantly working on, and there's different modalities that assist us with this, but group therapy kind of helps bring them all together in real time. The next piece is that we're hoping to foster or provide a safe space for practicing new behaviors. I'll often say to clients that here at the facility, it's like an arena, a practice arena to practice these skills. We're going to go out there and we're going to try our best, and we're going to, get a little bit messy and maybe make some mistakes. But the peers and the staff here are to support going through that, and it's a part of the process of growing and learning. And then the last piece here, building a sense of community and belonging. To me personally, this is extremely important. As I had mentioned, we want to prop people up so that they believe that if they are making healthy relationships with their peers in treatment, then they're going to be able to do that when they get out back to the greater community again. I'm a firm believer of whatever happens here in the therapeutic community is a microcosm of what happens on the outside. And so we want to help people develop their skill set through a recovery capital lens, to do what's best to sustain their recovery. Bit of a historical development here. The early foundations. So this isn't anything new. This has been happening for millennia. The idea of collective healing has existed for centuries in various cultures, and I'm thinking specifically about indigenous spiritual traditions where they're incorporating communal support and healing practices. So things like the peace circle you might have heard of, or the talking circle, or we have an indigenous healing circle today. There was so much emphasis placed on community and group work that it has developed rapidly ever since then. So the next piece here is we're talking about this modern concept, or a pre-modern concept of group therapy that started to take shape in the early 20th century. And so there's a guy named Joseph Pratt, and this was the early 1900s. He started medical support groups He was an internist and he was credited with some of the earliest forms of group therapy. He ran groups for tuberculosis patients, focusing on emotional and psychological well-being alongside medical treatment. His work demonstrated that peer support could improve coping skills and overall well-being. In my eyes, this is sort of one of the first people to look at this biopsychosocial model and how it can be applied to treating mental health in combination with physical health. And it's really quite fascinating to me that it started so early. The next piece here was talking about this gentleman named J.L. Moreno, which was the 1920s, and he was the guy that came up with psychodrama and spontaneity in therapy. And so Jacob Levy Moreno, he created psychodrama, which basically an interactive form of therapy where participants role play scenarios to explore emotions, underlying issues, interpersonal conflicts in their lives, and that sort of thing. And so we do something like this. It's called Satir Family Therapy. And one of our counselors who's been here for a long period of time, he's trained in this family systems theory, and he'll do what's called like an interpsychic model of the family system. And this is sort of like a psychodrama. And so you'll have the patient actually choose some of their peers to play different parts of themselves, and then it will act out in real time. It's quite fascinating. If you are interested, I would definitely suggest looking it up online. But basically, Moreno, he believed that spontaneity and creativity were crucial for healing. And we're a firm believer of that here at EHN Edgewood Nanaimo. We have an art therapist full time. We offer individual sessions and group therapy sessions as well. We also have music therapy program, and we have a few others as well. So the term group psychotherapy was pioneered as structured group sessions by Moreno. In post-World War II, we were recognizing that returning war veterans needed a lot of psychological support. Back in the day, this was what was understood as being shell-shocked, and group therapy became widely used. It's been effective way of treating PTSD and helping with reintegration into society. And Veterans Administration hospitals and mental health institutions have increasingly adopted this form of therapy over time. We're now moving into more of the modern era. A name that many of you have probably heard of is Carl Rogers. He introduced client-centered therapy to groups. We'll talk a bit more about him because he is such a important person, figurehead in this process. Fritz Perls developed Gestalt group therapy. We'll talk a little bit about that as we move on to some of the foundational stuff. And then Irvin Yalom, who's sort of like a hero in the group therapy community. He advanced the understanding of interpersonal processes. So Yalom's research emphasized that the success of group therapy relies on key processes like universality, which helps group members realize they're not alone in their suffering. So sharing my stuff, getting connected with other people. Catharsis, which is like this release of really strong emotions that have been there for a long period of time that have either been repressed or forgotten about. And they add to psychological stress. So being able to shed those in group therapy is quite a relief. And the third one that I wanted to sort of mention was this interpersonal learning, which basically provides an opportunity for group members to learn about relationships and intimacy in the setting itself. And so what I find really cool when working with people is you'll see underlying issues, unresolved conflicts, mother-father wounds, that type of thing come up, and it'll be present while we're doing some of this work together. And it's a great opportunity to be able to process some of the strong emotions attached to that. There'll be times where there's transference, where the client is projecting feelings onto the therapist, or maybe onto another one of the clients in the group, or there'll be countertransference and I'm feeling something and I need to be able to give some feedback and help redirect and walk through that process. But really what we're doing is modeling this healthy social behavior and understanding that conflict is a part of that process. Yalom's group continues to shape how group therapy is structured and facilitated today. And obviously there's a lot of different ways of doing this. We'll talk a little bit about what that looks like, but I just think it's really important to have some of those theoretical underpinnings. So Sigmund Freud was sort of the psychoanalytic guy back in the day, and his work on the unconscious mind influenced early group therapy. He really focused on individual therapy, but his theories inspired analysts. and to explore the unconscious dynamics played out in groups. So some of the stuff I was talking about, the unresolved interpersonal conflict that comes up when I'm reminded of someone in my family or someone that's done me harm in my past, and how that can be worked out in the group therapy setting. Um, Transference, so again, the redirecting of emotions toward the therapist or the group is a key concept that still informs this group work today. And it can be a really powerful thing to help people work through that discomfort, although alarming, can help people to feel comfortable and actually to start making changes in their life as well. It can be generalizable. The other piece here is cognitive behavioral therapy, which I'm sure many people have heard of. In a group therapy context, it focuses on identifying and changing maladaptive thought patterns. So maybe someone's coming up with a catastrophizing type of statement. I'm never going to make it. I'm hopeless, and this isn't going to work for me. And it gives the group an opportunity and the trained facilitator to be able to kind of probe, ask some questions, redirect, help restructure, and reframe the process and the experience. Practicing these behavioral strategies with feedback from the group can be very impactful. And we find that it helps to reduce some of these avoidance behaviors because it encourages gradual exposure to fears. By bringing up fears in group, it elicits sometimes like guilt, shame, remorse, all of these strong emotions that can be overwhelming. But in that group process, we can have others hold each other and walk through that together. This other piece here is the humanistic and gestalt approaches. Um, the humanistic approach was Carl Rogers, and he was a pioneering psychologist known for developing person-centered therapy. He was a key figure in the humanistic approach, which emphasizes personal growth and self-actualization. His work challenged the traditional therapist as expert model, promoting a collaborative therapeutic relationship. And so rather than being the wise sage giving the advice and expecting a client to take that and run with it and change their lives based on what I'm telling them. It becomes more of a collaborative encouragement and a work in progress. The relationship, the therapeutic relationship, grows as a result of this work done together. And some of the principles that we utilize that were developed by Carl Rogers that can be applied to individual or group therapy is this idea of unconditional positive regard, which is basically accepting clients without judgment and then fostering a place of safety. And so you can imagine in group therapy how important this is, especially when you have marginalized populations or people from different lived experiences. The next piece is empathy. And so deeply understanding and reflecting clients' emotions. Sometimes we'll use like motivational interviewing and repeat back to the client what they said to ask a question to further elicit the emotional response. This can be very powerful as well. And then this last piece here, which is called congruence or authenticity. I need to be able to show up as myself and work out my own stuff before I go to group therapy because it can be overwhelming. I need to know what's mine and what I need to take care of, and I need to know how to help the people in the group and to sort of keep that in relation to the work that we're doing. If I'm not showing up as myself, clients see it pretty quickly. And so if I'm able to model some of that behavior, I'm able to show up authentically, I'm able to regulate my nervous system, that modeling process, hopefully they're mirroring that back to me as well, and we can do some deeper work. This last piece here I had touched on, it's systems theory, which is basically like family and social dynamics in groups. The group is seen as a system. And so maybe the group itself is utilized in a way as to be more powerful than the self. Maybe it's something that we rely on and we go to for advice and we work out our problems. And it helps explain how the dysfunctional group dynamic. So if something emerges in the process and it doesn't feel right and people are getting uncomfortable, the trained facilitator can actually call that out and we can work on it together as a group. And usually there's some success through that process. This can be relevant for not just family therapy. We do it. We'll bring it up in our group processes here at EHN Edgewood and IMO in our substance use disorder primary program. It works quite effectively. But also think about this in a workplace conflict resolution process as well. This could be something brought up like with an EFAP provider or something of that nature, or maybe on like a retreat or something like that. Okay, so effectiveness across mental health conditions. This is where, for me, it starts to get pretty interesting. So, obviously, it's effective. Obviously, it's evidence-based, but why are there so many misconceptions about this process? Um, I personally believe that there's been a lot of bad rap coming from media sources and whatnot, and there's a lot of societal pressures that perhaps show us that this isn't the most effective way of dealing with emotional, mental problems. Um, However, what we do know about group therapy and why it is so effective is that it provides a sense of belonging and social support, which is so important to the healing process. Participants gain multiple perspectives on their challenges. It's not just the perspective of the therapist; it's other people with similar lived experiences walking through the problem together. It offers structured feedback and accountability, which then enhances growth. I'm thinking about outpatient programming, basically, or more specifically, aftercare programming for some of our clients that complete treatment. And there's people that are going from like 3 months all the way up to a year usually. And being able to vicariously experience what other people are going through is really inspiring. And so someone with 3 months might be looking to someone with 6 months and say, if they can do it, then so can I. And so then how can I make this work in my life? And taking the feedback from somebody that's been through it already can be really helpful, and it can enhance the treatment experience on the continuum of care. So there are a few different mental health conditions that I've listed here. Some of the more basic ones. Uh, Depression in general, I'm not going to get into the nitty details, but what we're talking about provides a supportive space to combat isolation. And so what we know is that the intrusive thoughts continue and it becomes pretty difficult to open up and connect to other people. The isolation piece is something that we try to combat a lot here in inpatient treatment, especially, and group is a place to get some of that out. The cognitive restructuring I was talking about earlier with some of like the cognitive behavioral therapy group work in a group setting can shift negative thought patterns, which can be very helpful as well. And then the peer validation, it helps reduce this self-criticism. The voices can be so loud that if I put my stuff out there, it's very likely that I'm going to be able to have some sense of connection because someone will likely have been going through what I'm going through or has gone through what I'm gone through. Um, Anxiety disorders, we see exposure to social interactions in a controlled environment helps desensitize fears. So, challenging again some of those negative thought processes. Members challenge each other's catastrophic thinking, like I had mentioned earlier, and avoidance behaviors. And so, there's this healthy process of being able to give each other feedback in a constructive way that's helpful, that's healthy. We'll talk a bit more about that in an upcoming slide. And this last piece here is it encourages relaxation techniques and coping strategies through group exercises. And so, if someone's dysregulated in group, we might even pause for a moment and we might do some box breathing. We might practice some DBT skills, mindful breathing. We might go into a brief meditation just to get people level again and keep them from flooding in the group process. The idea is if we can remain in this place of neutrality in the window of tolerance, then that modeling, that mirroring will be very helpful to keep people deactivated in group as well. It's pretty interesting to see at times when someone gets very upset, maybe they're experiencing a reaction to something and they're angry, how the rest of the room will react to that. The fight or flight response is ready to go. And so taking a calm approach and utilizing some of these other skills to get people back down and level again is pretty influential, pretty helpful. And when we're talking about post-traumatic stress disorder, I'll briefly touch on this. Um, so trauma-focused group therapy provides a safe space to share these experiences, and we see this a lot with like first responder programs. There's a tight-knit group where they're able to really talk about their stuff and get it off their chest, and they feel safe and secure to do that. Members learn from each other's coping strategies. So how did you get through this? How are you getting through it today? And then modeling some of that behavior as well. And then encourages the reprocessing of traumatic memories with peer support. And so I'm not going back into this state of rumination, obsession on my own and trying to deal with everything by myself in isolation. I can bring it to the group and we can work on that together. Again, it does take a trained facilitator to be able to sort of guide someone through that because there are certain instances where we will hold someone back a little bit as to not quote unquote trauma dump dump and sort of like get people really activated in the room. It's learning about how to share things, and the connection that that brings and the ability to process these strong emotions associated with it. Substance use disorders. Um, this one can look very different in different formats. So peer support enhances accountability and long-term recovery. For me, what this looks like is the group therapy process, inpatient treatment setting. We have a couple of different groups here. We have a self-assessment group on Monday and Friday, and that's more like clinician driven. What we do is we set SMART goals for the week, so specific, measurable, attainable, realistic, time-bound goals that are sort of like in conjunction with the treatment outcomes. So I might look at something to do with like my physical, mental, spiritual, or social health and how I can get there and how I can have my counselor support me with that. Another thing that we work on is sort of just pure check-ins and talking about the challenges that have come up and how we've been able to get through them and sort of being able to talk about post-traumatic growth and resiliency and what that looks like. It also reinforces motivation through shared experiences and success stories. So I'm thinking again about inpatient treatment, and we have what we call process groups. And in these process groups, it's really client driven, and the clients are there to share their stuff, to talk about their feelings, and to maybe share some parts of themselves that they've never shared before. And so this can be something that's extremely connecting and can help really, influence this perspective on the importance of social connection for recovery. And what we find in this setting specifically is that it helps to reduce the shame associated with addiction by normalizing these recovery struggles. So if someone's talking about the craving they're having and the thoughts of relapse, they can put that out, and the peers can help them walk through that and talk about their own experiences as well. Outside of the actual group therapy processes, there's other like psychoeducational groups, and there's other 12-step community groups as well. I'm not going to talk a lot about that today, but some of the principles in those groups have been utilized in the group therapy processes that we have here as well. So I'm thinking about spiritual principles of like honesty, open-mindedness, willingness, anonymity, confidentiality. All of these things are taken into account. And then we have like cognitive behavioral therapy based programming as well, like smart recovery groups. We also do psychoeducational skills groups. So we have afternoon structures that are CBT, DBT, relapse prevention, et cetera, et cetera. And then one last piece here just on severe mental illnesses, psychoeducation, like the groups I had just mentioned, the more structured processes, improve coping and strategies and interpersonal skills. Like, so again, we're practicing these things in real time. And they encourage social reintegration and self-acceptance. That's really at the end of the day what we're looking for is that we want a higher quality of life and working towards abstinence if it's a substance use disorder program. So effectiveness continued. This next piece here, we're talking about group therapy is effective for a range of conditions and presenting issues. We mentioned a few of them, so substance use disorder, PTSD, depression, anxiety disorders, other severe mental health disorders. There are specific groups for obsessive compulsive disorder, for example, eating disorders. We have a small group here at EHN Edgewood and IMO. Chronic pain, this can be very helpful. Research shows that these group therapy processes are particularly beneficial for marginalized groups, including the LGBTQ2IA plus communities, indigenous populations, BIPOC communities, etc. And the reason for this being is that it provides stigma reduction and solidarity among peers. And so I can't say this enough, how important it is to be around people with a similar lived experience, to be able to take the burden from that emotional pain that so many people feel. So, misconceptions about group therapy, probably brought on, compounded by media. Myth, it's less effective than individual therapy. Meta-analysis show comparable efficacy. So this is an evidence-based practice, and it can be just as helpful as individual therapy. This is something that comes up a lot with with clients when they come into the facility. I expected to have this much individual therapy each day because it's the thing I need and it's the only thing that's going to help me. And a large part of the initial conversation is like, we place a lot of emphasis on group therapy. This is why we'll be doing our 1 hour session once a week. And then in tandem, you'll be participating in like 5 or 6 hours of group therapy. And it's helping them develop that trust, respect, and therapeutic alliance with their clinician so that they can feel like they can trust other people and then go to group and talk about their stuff. Myth, it's just a discussion group. Reality, sessions followed structured evidence-based frameworks, as I've talked about in the earlier slides. Not all of them are structured, but we do like to outline the group rules at the beginning, and I'll talk about that a bit more in the upcoming slides. Myth, it's not confidential. Um, the reality is that confidentiality is a fundamental principle enforced by facilitators. Like in the counseling world, client confidentiality is number one. Obviously, there are a few things that would get in the way of that. I have that on another slide, what that could potentially look like with confidentiality rules in group therapy. But when people come into the facility, they sign a informed consent document, and it talks about the confidentiality agreement, and it also speaks to the group therapy process. And again, those group rules set in the beginning that everything that happens in group stays in group, and it's between group members. We make sure that everybody knows that. And the other piece is that clients know that in consultation, we work in an interdisciplinary team. And so if there's something challenging that comes up or a theme that needs to be worked on, we're going to bring that to consultation or case conferencing. One member dominates the group. I'll laugh at that a little bit because it does happen. Oftentimes there are loud voices and there are people that aren't speaking at all. And this is just kind of the nature of the game, the dynamics of the group. So it's really up to skilled therapists to balance participation and address disruptive behaviors. So like I said, interpersonal conflict actually becomes an opportunity for growth, an opportunity for learning, and we can point that out and kind of work through it. We can bring up some of these troubling behaviors if someone is sort of like taking emotional hostages or something like that. We can work on helping them see that, and the peers can work on giving them feedback. Myth, it's only for mild issues. The reality is that it's effective for a wide range of conditions, including severe mental illnesses. Um, I just want to mention as well, like shout out to the Guardians program that we have here on the EHN Edgewood Nanaimo grounds, and they do some great work with combat veterans and other first responders with concurrent issues. And group therapy is one of the most effective things that they utilize because of some of the things that we were talking about earlier. So applications of group therapy. So obviously, there's lots of ways to do this. None of them are perfect. Some of them are messy, and some of them are a work in progress, right? You could have group therapy at inpatient or outpatient clinics. I talked a lot about my experience here working at EHN Edgewood Nanaimo in the inpatient core program, but the outpatient programs have these processes as well. And so I just want to talk about substance use recovery. I had mentioned 12-step models like Alcoholics Anonymous, cognitive behavioral groups targeting relapse prevention like SMART, and then process-driven groups during inpatient treatment, like the ones I had spoken to in an earlier slide. Adolescents and children, there can be groups specifically tailored for adolescents and children, focusing on emotional regulation, peer relationships, and coping skills. Trauma and crisis intervention, maybe there's some support survivors of abuse, violence, natural disasters, all of these things can be held dearly in the group therapy process. Uh, what we see is that it offers validation and tools for developing resilience, that aspect of working through adversity. Workplace settings. Maybe some of your workplaces need to have some group therapy, maybe on a lunch break. I know sometimes I think that perhaps it might be helpful for everybody. It enhances teamwork, conflict resolution, and leadership. Sometimes we'll bring in not the group therapy process, but elements of the group therapy process when we're doing team consultation, and it can be quite effective because it allows us to give each other feedback in a constructive way as well. And then this online therapy piece, which I think is brilliant, because it has expanded accessibility to underserved populations across the world. I'm thinking about some of our rural communities in northern Canada and how aftercare programs have been delivered when there is access to internet, and how that maintains effectiveness in some of the tools that people have learned while they're in treatment when they have to return to an isolated environment. I know that during the COVID-19 pandemic that online therapy became huge, and obviously there are different ethical dilemmas taken into account. But for the most part, it's been a really helpful tool. And it's the same thing with these 12-step support groups and whatnot as well. Okay, so advantages of group therapy. Cost effectiveness. So there's an economic component to this for organizations. Provides access to therapy for individuals with financial constraints. Not just that piece, but it also lightens the load on the need for therapists and the cost of mental health support in many different ways. I don't have the stats on that right now, but it's a pretty interesting thing to dive into. I would definitely recommend having a look at it. Peer support encourages sharing of experience and mutual understanding, like we talked about, and reduces stigma and fosters a sense of belonging as well. Skill development provides opportunities to practice communication and coping strategies, encourages accountability and feedback in real time. Again, so we're in this practice arena doing this thing together. Diverse perspectives broadens understanding through exposure to varied viewpoints. And so this can be really fascinating. We can call out microaggressions, for example, in group therapy, and it can be a really healing experience for everybody involved because oftentimes these biases get in the way of being able to open up. And so a skilled facilitator is in there being able to advocate on behalf of one client, give feedback to another client, and then help them see the various perspectives involved with it and perhaps how societal pressures have built this viewpoint. It can be pretty fascinating. And then there's this flexibility. So adaptable to cultural, age specific, and condition specific needs. We can have groups for this, that, and the other person, and they can all be very helpful. What are some of the challenges and limitations? Stigma and misconceptions. So there's some public misunderstandings that deter some individuals from taking part. And a large piece of this, in my eyes, is like, um, how am I going to be able to share with people I don't know about stuff that I've never told anybody before? And those are all fair enough. And I think that it takes a bit of a risk to get in there, an emotional risk to do some deeper work on those underlying issues. And hopefully, the relationship with the therapist is strong enough that the encouragement is there to be able to be collaborative and walk into this thing. Group dynamics can be challenging as well. So there's risk of conflicts, disengagement, or dominance by certain members, like I mentioned. So again, the facilitator needs to be in there and be active enough, but hands off enough at the same time to produce optimal outcomes. Suitability. So someone may not meet the needs of individuals requiring intensive one-on-one support, but they may be able to go into group therapy or vice versa. So screening is then essential to match clients with appropriate groups. And we do that throughout the process here. Like we have different psychometric testing in the beginning of treatment that helps us understand like maybe someone needs to be in like a sex love relationship program or a gambling program or a disordered eating program. And then we just kind of go from there. And then we make our decisions always in consultation with the interdisciplinary team. And the screening helps a lot with that. And then in the more like, genders focused process groups, what we'll do is we'll talk about the dynamics in the group, and if we need to make changes, then we'll make those informed changes together as a team, and we'll make sure we walk through that with the clients as well. The last piece here to consider is logistical barriers. So scheduling conflicts and access to diverse group types can limit participation. Often staff sort of models the population that we have. And so we want to make sure that we have the right people in place to be able to do this. And group therapy is not one of those things that's really focused on in a lot of graduate programs. And so it's definitely a learning curve for a lot of therapists when they come into an environment like this. So now we'll talk about just what's going on here at EHN Edgewood Nanaimo. Um, this is the introduction to what we do. So we provide a safe, supportive environment for personal growth and healing. The goals of group therapy here at Edgewood, we want to foster some self-awareness and behavioral change. We want to be able to help people uncover unconscious motivations, behaviors that they've been stuck in for a long period of time in order to start making some changes in their life. We want them to build meaningful connections with others, and it starts often in the group process. And we start to see these relationships bud and bloom out in the common area. Encourage mutual support and shared insights. And so, again, it's this idea of like learning to be introspective and authentic and sharing feedback accordingly. Some of the initial concerns that often come up, people feeling anxious about opening up in group, like I mentioned, that's okay. Hopefully, they can sit in and they can be a part of, and they can see what it means to be welcome in a group. And those initial sort of ground rules are set, and it's secure and safe and allows people to be themselves. Facilitators ensure a welcoming and confidential space, and that's up to us to be able to share with people what's expected and the types of behavior that may not be permitted in the group. Understanding group therapy. So, by definition, it involves collaborative discussions facilitated by trained professionals to address emotional and psychological challenges. Confidentiality is strictly maintained, except in cases of mandatory reporting. And so, what is mandatory is determined by different regulatory bodies. But basically, we want to reduce and eliminate significant risk or serious bodily harm. And we take these ethical dilemmas very seriously. There's a duty to warn often on reasonable grounds to suspect abuse or neglect of a child or a senior. But we do our best to walk through this confidentiality piece because it is so important to maintaining the integrity of the relationship. And so, again, like we'll explore things. Maybe we'll have a conversation one-on-one to determine what the actual process was involved with this incident and whether there might be like elements of fabrication or whatnot. And then we'll consult with supervisors and managers about next steps. We take this very seriously. The process itself, open dialogue, structured activities, and mutual feedback to foster growth and learning. And so as the group grows, the process grows, and it goes from being directed more so by the facilitator to then the stronger senior peers in the room being able to give feedback and sort of help shift the process in group as well. Once we see that, we know that the group is getting healthy, and it's a pretty cool thing to be a part of. How group therapy helps. So, key mechanisms of change. Establishing ground rules and cohesion is critical. And so for me, what I talk about is the importance of confidentiality, and I'll ask a senior peer to kind of give us the lowdown on their experience in group and what's important to them in the process. So something that comes up is that only one person talks at a time. We call this no cross talking. There may be redirection if we're getting into the details of deep-seated trauma, so as not to activate everyone in the room. So it's learning about how to share and how to be emotionally connected. And then we'll also talk about just the process of respect and peer support and what it means to be a part of a team and to support each other. And this might be counterintuitive, but we also say the group goes on all day. And so if they need to talk to each other, they're there. Because another thing we say is that you can't take your therapist with you when you leave. And so we're hoping that you can develop the skills to be able to maintain healthy relationships. This next piece is the emotional safety. So we encourage honesty and openness in a non-judgmental space, just like Carl Rogers said. We recognize shared struggles to reduce feelings of isolation, and then overcoming anxiety. Initial discomfort eases over time, leading to deeper connections and insights as well. So strategies to maximize benefits of group therapy. Active participation. If you sit there and don't do anything, it's probably not going to work very well. So be honest and open with yourself and others. And this is the encouragement that we have for people. Share both comfortable and uncomfortable feelings. Sometimes I'm thinking about substance abuse recovery is that a strong emotion, a positive strong emotion could be a bigger trigger for relapse than a negative emotion or a strong uncomfortable emotion. And so we want to be able to talk about that and walk through it together. Effective communication, speak directly to others rather than about them. And so some feedback that we give clients is speak directly to people and make I statements. Because if we're making I statements, then we're taking responsibility for our behavior. The other piece is this constructive, non-judgmental feedback. We walk through the process of feedback with people quite a bit in treatment, and we want to work on treatment interfering behaviors or things that get in the way. And so the feedback is always based on observation. I try to tell people not to focus on the opinions because that can lead to some pretty uncomfortable conversations. And it's usually speculation. But if it's an observation, I'm seeing someone do something, or I'm talking about my lived experience, it's very different, and it's usually taken a lot better. Respect and responsibility. So avoid giving unsolicited advice. This might be another rule that we put out there. No advice giving, feedback is welcome. Advice giving is pretty simple, but if we're all in this together, maybe we should be seeking advice from those that have a little bit more experience. And the last one, show empathy and patience towards group members. This is a great place to practice some of those spiritual principles, tolerance, patience, reminding people of what they were like when they came into treatment and how far they've come, and to be able to welcome people and make them feel safe. So again, some unique benefits here. Relief from isolation. Discover shared experiences and commonalities. We do lots of room checks, and we want to make sure that people are up and they're about and they're in group. Like I would prefer someone misses a structure, like a lecture, than missing group therapy. I just think that it's such an important piece of what we do here. And so we make sure that people are doing their best to sit in there if they can. Obviously, there's different barriers involved, the detoxification and things like that, but we address them on a case-by-case basis. Hope empowerment. Witnessing others' progress inspires personal growth. Learning opportunities gain insight into interpersonal dynamics and addiction recovery. Acceptance and validation. A supportive environment to explore and heal. So we really want to be conducive. We really want to be able to help people feel secure and safe in what they're doing. Emotional honesty in group therapy. So what's meant by that? The power of openness is to identify and express feelings honestly for meaningful change. And so this idea of congruence or authenticity that Carl Rogers speaks to, showing up as ourselves and being able to share ourselves freely and honestly. Key emotions. So maybe we're able to work through some strong things like anger, sadness, and fear in order to reduce the risk of relapse. A lot of times these are the main offenders, resentment being the number one, perhaps. But being able to talk through these things and really look at what's underneath these strong emotions can be helpful. Avoiding hiding behaviors. So, again, the avoidance of fact. Talking around the answer prevents emotional growth. We want people to be direct and forthright in what they're doing, and we want to encourage that as much as possible. Again, it's this piece of interpersonal effectiveness or effective communication. Overcoming common challenges. So there's usually an initial hesitation or defensiveness, and that's normal. There's anxiety about sharing, but it fades and trust builds. And so we want to be able to share with people what that looks like on their journey and how most people go through this. And so maybe we'll utilize the help of peer support to walk them through what it was like in their first week of treatment as well. Group dynamics. I can't mention this enough. Skilled facilitators ensure balanced participation and manage conflicts. When there's strong enough peers, they can help manage the conflicts, but it's up to the facilitator to keep the room safe, the integrity of the group safe. Commitment, consistent attendance, and engagement are crucial for success. So consistency is key, and we need to show up together to get well together, or we'll stay unwell together. So some principles we abide to here, some core values: respect, honesty, and active listening. The therapeutic environment, confidentiality, empathy, and mutual support. And then the facilitator role, guiding discussions, ensuring safety, and fostering connections. So the key takeaways, what I'd like to really bring home here. Group therapy has a long history rooted in evidence-based practices. It's been going back for millennia for different cultures, and these experiences have grown and they've shown to be effective over time. Diverse mental health conditions and populations can be helped with the group therapy process. Challenges include stigma and group management, but benefits outweigh limitations. It offers unique opportunities for peer learning, connection, and growth. And the last piece here, which is important for organizations, is that broader adoption can significantly improve care delivery and we can help more people. All right, that's it for me. I'm just going to stop sharing.
Amazing. Liam, that was absolutely fantastic. Huge round of applause. There's a react button at the top if you so choose. But way to go. I learned a lot today. If you'd like, in the Q&A or the chat, feel free to ask a question. Liam will go through that together. Cameron, thank you for raising your hand. But if you can just add that question in the Q&A or chat, we'll get to it. I do have a question to kick things off, which is, let's say I've only ever tried individual therapy before, and there's an option for me to experience group therapy, but I'm hesitant. I'm not sure if that's what I want to do. How would you sell it to me? How would you tell me that group therapy is something that I should try?
Yeah, I would make sure that our therapeutic alliance is strong first, Jonathan, that I know that you trust me and that there's an element of respect there. Because I don't think the influence would necessarily be in place unless that happens first. And so in an inpatient environment, I can kind of walk you through that process and what that might look like. Say
Please.
it like a street entrenched person might come into treatment and they've been living in isolation for a couple of decades and they don't feel safe coming out of their room. I'd probably meet that person where they're at and go into their room with their permission and speak to them and kind of walk through the process of social connection and how it's actually going to help them come back online again. And I would slowly but surely build that trust and respect so as not to push too far. And so if you're in a position of feeling uncomfortable, I'm going to respect that and I'm going to meet you where you're at. And then I'm going to push you a little bit by little bit as time goes on, you feel more stable to find your way into the room. So maybe it starts off with you just putting your foot in the door and saying hi and then walking out. And then maybe the next step is you sit down for a couple minutes and you run out of the room. I think these are all steps in the right direction. That's probably what I would do from a trauma-informed approach.
I love that. Thank you so much for sharing that, Liam.
Yeah, of course.
I have another question. I have a
Yeah.
list.
Yeah, for
Uh,
sure.
I was sitting here taking notes the whole time. Let's say I'm new to group therapy. I've recently graduated from psychotherapy school. Most of my practice has been doing individual counseling. What are sort of three tips you would give a new group therapy facilitator?
Yeah, I wish I had some of these tips when I started because it can be very overwhelming. Almost like being on stage a little bit. And like, I was
Right?
talking about the psychodrama, and it's like you're in the middle of a psychodrama to start off. And I can reflect back on one of my first group therapy sessions on my own. And I was a young, eager therapist sitting there, and I thought I was gonna change the perspective of everybody in the room. And they knew that I was pretty fresh, and the guys were out for blood, basically. And they put me to the test. They started asking me complicated questions. I took it personally. I felt like I was being attacked, and I thought that I was being dishonorable in the process. And so something I learned after that is that it's okay to bring an element of yourself to group therapy. The personality is really important, but it's also important to be able to set boundaries. And so if there is an opportunity, the group rules, like I had mentioned, should always be stated because if that's in place, there's an air of clinician oversight that can be brought back if needed. So if something gets out of hand, someone's like oversharing or people are getting activated, I can say, hey, remember what we were talking about earlier, how we had this emphasis placed on we're going to ground ourselves if we start to feel escalated. Can we maybe work on that together right now and just take a couple of deep breaths and then reset? So three things I would say, self-awareness. I've got to understand what's going on for me internally. Second, having some confidence about being the leader of a group. It's just very different. And then the third piece is to bring your personality to the situation and have fun with it because when you're in group, you're really a part of the process, and having a bit of humor can be really powerful too.
That's fantastic. Really great, Liam. I have one more question, and again, if anybody has a question for Liam, feel free to drop it in the Q&A or the chat. I'm here keeping track as well. Um, I think what is something, let's say you're in a session and somebody shares something, really heavy and it sort of like disrupts the flow. What are some practical things as a facilitator you do to sort of, bring back the flow and sort of restate the trust a little bit?
Yeah, I would the first thing that I'll do is usually validate the experience and say, with unconditional positive regard, like our boy Carl Rogers, just saying, you know, what you shared today was powerful and you took a risk. And I want to be able to hold the space for you to process that. And I would make some direct eye contact with the person if they're willing to. And as they start to get grounded and I can mirror some calm behavior back to them, then we might be able to ask other people in the room how they're feeling. And so, okay, I'll come back to you in a minute here. Let me just check in with the rest of the people in the group. How are you feeling with this share? What came up for you in this instance, to help sort of not sidetrack the process, but to move in another direction and reframe the experience. And then something that can be really powerful as well that I've utilized and been shown, and it can help is have the person who's dysregulated start to make some eye contact with the people in the group to form that trust and respect again. And they go around the circle, make some eye contact, and then sit in their space, and everyone seems to be a bit more regulated, and then we can get back into things again, ask a couple of questions, get into it.
Love that. Liam, we have another question from Tracy. Thanks so much
Yeah.
for that question, Tracy. What is your understanding of the best practice for ideal group number in terms of participants to clinician ratio?
Yeah. Ideally, it's like 10 to 12 clients. Um, I mean, you can have less than that. More than 12 is too much. 10 is an ideal number because it allows the personalities to sort of shine through, and it gives you enough different backgrounds, underlying issues, and interpersonal conflicts to work with so that the group continues to operate. Sometimes when the group is too small, it can cease to function. And when it's too big, it's chaotic. If there were 10 people, it would be ideal to have two facilitators. So you might have two trained therapists in there working together. That's the best case scenario. Sometimes the staffing becomes an issue. And so one is obviously the way to go, but two would be the most ideal.
Amazing. We have time for one last question from Kelly over here. And this is a really, really interesting one. I, Kelly, I co-facilitate a mandatory peer group for medical professionals with a substance use disorder. They are required by their professional college to attend weekly for 5 years. Some members are very hesitant to ever open up. Are there any differences with mandatory groups? No one seems upset they do not involve themselves, but it is an interesting dynamic.
Yeah, that's a fascinating question. I think it depends again, like on the regulatory body that they're associated with. Like I worked with clients here in BC that are like with um, the College of Surgeons and Physicians, and they have mandatory requirements, reporting requirements. And on my end, it's like I encourage them to report as much as they can, and sort of like do that in a place of agency where they have the decision to do that on their own. But again, it depends on the requirements of their return to work recommendations and that sort of thing. We often host medical group therapy processes as well, but our psychiatrist here will run them. And so I'm not certain what the requirements of a group would be, but I do know with an individual that there are certain things that need to be stated. Especially if going back to work within there's a time period and there's responsibilities in place.
Amazing. Well, Liam, that does it for today. Thank you so much. It was a fabulous webinar. I learned so much. For those still here, we have lots more webinars coming up in the coming weeks and months. So stay tuned. Keep a look at your emails, and we'll see you next time. Take care, everybody.
Awesome. Thank you so much. Thanks, Jonathan.
Take care.